Today, we have a medical practitioner, a general practitioner too, Doctor Aniebo Anthony, based in Saudi Arabia. Well, we'll be asking you, sir, about the first ever womb transplant that was done in the United Kingdom. Many people have referred to this as the light infertility treatment. What can you tell us that made the womb transplant successful?
Thank you so much for granting me this opportunity to be on your program. Um, it's going to go a long way in helping women who have challenges in conceiving, especially those that are born without uterus, the womb. It's actually a rare condition that happens in maybe one in 5,000 women. So this takes sheer dedication, and determination, and wanting to put your country in the Hall of Fame when it comes to the medical practice. It will interest you to know that this is not the first time this has happened. The first event happened in Sweden, sometime around 2013. And since then, several other countries have keyed into these noble achievements, the likes of United States of America, Saudi Arabia, where I'm based, Czech Republic, China, Brazil, and the rest of them. Just about 10 or 11 countries have had a success to this line. This particular noble program started in the United Kingdom as far back as 2015. But it got delayed during the COVID era. We all know the COVID pandemic, the toll it took on the world as a whole. But after that, because sometime in February, it was eventually successful. Bearing in mind the number of medical team, doctors, nurses, anesthetists, and everybody cut across. But it came into limelight when it was published in the journal and sometime 4 or 5 days ago. That's why everyone in the world is giving them upload. So I would say it's a huge success for them.
Okay. What difficulties will you think that African countries will face if they want to do womb transplant too? Considering the difference in health culture and healthcare and our health sectors too. What before now they always sought for surrogacy, but now you can do womb transplants. What do you think it shows for we in the African continent, the Africans?
That's the very valid concern you've raised. Replicating that here in Africa, first of all, you have to look at, like you said, the cultural difference, and of course, on the healthcare. In Africa, we have that belief of reincarnation. Most people will say, "Oh, when I die, please bury me with my body intact." They believe that maybe in the second coming, they might come back. And most people are not enlightened in terms of donating various parts of the body, organs or appendages of the body. But of course, there seem to be some lights across the tunnel. People are beginning to change. I'm sure you are aware of donating kidneys, their kidneys for transplant to loved ones. I think beside the cultural change, the other major issue will be financing this particular project. Is actually a huge project, cost effective. Like this particular case study, the one in the United Kingdom, it took about £25,000 for this particular case. And you have about 30 health workers involved. And these health workers, it's more like a voluntary work. They were not paid for this service. So the 25,000 were put in for both just the research and all that. So if you try to replicate that in Africa, you would have to need probably like a donor agency that will fund that. And of course, the impact of the government. Otherwise, it's going to be a big challenge for us. But I think it's doable anyway.
It's doable. Okay. Knowing also that, as you said, it took a whole lot £25,000. That's a whole lot of money when injected into the health sector will go a long way. And do you think it's also the habits of African medical practitioners to volunteer? I know some of your work ethics is saving life. Most the core one is saving life. But for doctors to volunteer, knowing the economy, the African economy and all, is it feasible in the country? Is it feasible in African countries?
Feasible. I'm sure you are aware of there are some programs. Let me give an example, like Doctors Without Borders, where you have health practitioners volunteering to offer free services. Most time, maybe when it's time for electioneering purposes, people volunteer to do free health outreach. The missionary people volunteer to do, free health care. And I think with involvement of government and creating adequate awareness, of course, people would want to volunteer, because if you are part of this great team that would succeed in such a big task, your name will be written in gold. Your name will be written in gold. So I think with adequate um, awareness and campaign from the government, most people would volunteer to do that, and that would slash away the effect of costs.
What do you think is the key component that the Africans in an African country we have to consider before venturing into this procedure? What should we take into account?
Okay, thank you. Primarily, patient selection is key. Knowing that this particular patient, are you right for this particular procedure? What are the indications? The case in the United Kingdom, the primary patient was born without womb, but had other structures, reproductive structures like the ovaries are intact there. So you need to select your patient. And even after you have selected the patient, next to be getting a donor. And for you to get a donor, you have to get somebody who is willing to, okay, I'm giving my womb, which is like a live donor. It doesn't mean the person is going to die, so creating, it still falls back to that awareness, creating that awareness. And even after getting a donor, why would you want to carry out this surgery? The fact that somebody doesn't have a womb doesn't necessarily mean you want to perform a surgery to fix a womb for this person. Is this person willing to, what is the desire? Does she want to carry a baby? And then for those maybe who have lost their womb to maybe one reason or the other, let's say maybe due to malignancy, cancer, or have had surgery that they've lost their womb. This is like giving an extra hope, to replace that. Okay, now, even if you have donors funding this particular program, yes, you have replaced the womb. Does this person have the capacity to attain childbirth very fast? Because after transferring the womb, you need also in vitro fertilization, IVF, for this patient to conceive. After conception, for you to deliver this baby, you also need to deliver through cesarean section, CF. So the patient selection will require those that can afford that. Let me assume government want to fund the transplant. Of course, government will not fund the conception for you and your delivery. And even after this procedure, you need medications to keep what we call host versus graft rejection, because the womb is foreign to your body. The patient needs to be on medications to downgrade the system so that the body does not reject that. So you need to marry all these together. It is actually quite capital intensive. So despite creating the awareness, you have to go through so much factor in selecting your patient, those that meet the criteria. And of course, you also have to counsel your patient adequately, because we wouldn't want to hear that, oh, we lost this patient due to follow up. Let me assume the patient meets all the criteria for womb transplant and can afford IVF, can afford a cesarean section. Of course, the patient, the womb shouldn't last more than 5-6 years in the body. Immediately they've completed their family cycle, they should go for another surgery to remove the womb, because the womb wouldn't stay there forever. So you need to marry all these. These are challenges that we need to overcome. So it's a stepwise something. So I think we'll take it one step at a time, but we will get there. Definitely.
Okay, thank you, doctor. But with the economy, let me say, it's with all these things you've said, we know it's very expensive. It costs a lot. But how could African countries make sure women have fair share, even without being rich?
The criteria for patient selection. When it comes to a patient having a particular defect, it doesn't have to select whether you are rich or poor for you to have a particular illness. So let's say for you to be born without a womb, it doesn't select if you are a president child or a poor child. You can just randomly assign to a different individual. So if government put in place an adequate program, to monitor patient selection, when you have a program laid down, you know that there is no bias in patient selection. So if somebody comes in and meets those criteria, then the person just goes down the already pre-planned program. So there's no favoritism in that. So I think for you to have fairness, equity, and justice in this, there has to be a government monitoring of this particular program.
Back a little. You said the one that they did successfully in the UK, the patient actually was not born with a womb.
Yes.
Does this mean that those ones that still cannot bear children but do have a womb does not stand a chance? Or what do you think? How is it going to be?
Well, if you look at infertility, managing of the infertile couple, there are several factors that would prevent a woman from conceiving. So if somebody has a womb ab initio, then most likely the problem is not from the womb. Because if there's a problem in the womb, there are advances in science that can handle that. Let me give you an example. There's what we call uterine diathesis, where a woman has a womb and you have a septum, like a plank in between, like a plank in between the womb, dividing that. So it's more like she has two cavities where baby can stay. So that alone can cause infertility. So if a woman is born with such a womb, for instance, we have procedures like laparoscopic procedures that we can use to, cut those adhesions and baby can stay in the womb. So, but for this particular uterine transplant, it is actually built for patients that are born without womb, one, or two, for those who have lost their womb for one reason or the other, that naturally would have gone for maybe a surrogacy or other, they can now, go for that particular procedure. Or, of course, with the recent trend of having trans women. So, for a man who is transferring to a woman, though that is not possible yet, but in the near future might be possible. For those trans men, women converting to men, when they want to go for their gender reaffirming surgery, they might donate their womb, freely. There have been some studies on ground where you have questionnaires, and those women changing to men gladly want to donate their womb to people. So I'm sure that over time, with proper patient selection and counseling, all these challenges will be a thing of the past.
Okay, thank you very much, doctor. That will be all.